Good day all. Today the title of my presentation is Evaluation of RULA and NDI for Assessment of Neck Musculoskeletal Disorder among Medical Laboratory Scientists, Occupational Risks and Job Scopes that contribute to neck musculoskeletal disorders. My supervisors are Dr. Azrina Azman and Dr. Siti Rosita Mahmud from UTM. Structure, we have introduction, literature review, methodology, data analysis, discussion and references. Background of the problem, medical laboratory scientists or MLS are exposed to a number of ergonomic risk factors in the workplace. The job scopes of MLS contain static and awkward working postures, high frequency and prolonged static duration. Work-related neck disorders are unnoticeable at the beginning stages as the symptoms are usually mild, and the MLS are also ignorant due to their busy working schedule and treat the neck or muscle pain with regular painkillers such as ibuprofen, especially during COVID-19 pandemic and current endemic phase. I'm sure everyone would have known during this pandemic, laboratory received many samples for testing and diagnostic purposes. Problem statement. First one is WRNDS are unnoticeable at the beginning and the MLS are ignorant. Number two, awkward working postures of MLS on different job scopes could be habitual. Number three, workstation related factors and job scopes contribute to development of work-related neck disorders. Number four, absence of specific guidelines on working postures according to job scopes for MLS. Objective of the presentation or the research of the study is to rank postural risk of MLS on 4 different job scopes, to identify high-risk job scope that contributes to work-related neck disorders. We have research gap here. First, studies about ranking of postural risks according to MLS job scopes that contributes to work-related neck disorders were not found in Malaysia. Even we only have randomly and also on other body parts. Okay, no specific data on ergonomic guidelines is being implemented in Malaysia according to MLS high-risk job scopes. Guidelines that are available, we can see here, we have guidelines on occupational safety and health for sitting at work 2003. Okay, for literature review, I just cover a bit. I've covered basic anatomy and physiology of neck, and from previous researchers, studies show workers in highly repetitive or static tasks have shown a decrease in work-related neck disorders or symptoms after a major change in workload. A trend for a positive relation between neck flexion and neck pain was found, suggesting an increased risk of neck pain for people working with the neck at minimum of 20% of flexion for more than 70% of the working time. K. Thompson MHS 2003 found 55 to 60% of musculoskeletal complaints among cytotechnologies are on neck region. Agrawal 2014 found MSDS most prevalent on the neck region, 18 to 78% among laboratory professionals. The MLS are considered to be sedentary workers, and the stress involved with this job can affect the musculoskeletal system. Types of work-related neck disorders, we have tension neck syndrome, severe brachial, cervical rhizopathy, stiff neck, and neck tendinitis. Symptoms of work-related neck disorders is like joint stiffness, muscle tightness, pins and needles, redness and swelling. Could be from mild, moderate, and advanced symptoms. Work-related neck disorders risk factors are repetitive motions, awkward postures, overstretching, prolonged static posture, prolonged sitting, prolonged neck flexion, extension, rotation, and lateral flexion. So job scopes, we have blood banking, hematology, microbiology analysis, performing laboratory tests, operating biomedical analyzers, pipetting, microscopy, working under biosafety cabinet. Methodology, we did use on 31 MLS from KPD labeling medical laboratories. Study design, neck pain score using NDI is a qualitative method. and semi-quantitative is RULA, working posture characterization on angles of neck flexion, extension, and side bending. These are the neck awkward postures. Neck disability index, we have ranking of mild, moderate, severe to complete disability. RULA, we have level of postural risk, a stable score. Further investigation change may be needed. Further investigation change soon. Investigation and implement change. Comparison of NDI score and RULA postural risk rank is done to determine the correlation between neck pain and working posture according to job scopes. Presence of neck pain shows 90% of the subjects had neck pain. Next disability index score shows that 48% of the subjects have mild. Analysis of RULA shows that at least 61% need change that may be needed. Analysis of job scopes and postural risk. We can see that job scope of microbiology, which have culturing, striking, and basically most on all these bacterial and all these bacterial and germs and all kind of culturing has the higher risk of RULA postural risk, which they do the work under the biosafety cabinet. Discussion. Presence of neck pain was found in 90% of the subjects. Graph 1. Neck disability index scale showed that 10% of the subjects have no disability, 48% of the subjects have mild disability, 39% have moderate disability, and 3% had severe to complete disability. You can see in graph 2. High presence of neck pain, 90% MLS was reported in the study. A linear relationship can be expected of neck pain with magnitude of neck flexion, angles, and postural risk level. Thus, in this study, the highest ranked job scope that pose occupational risk for WRNDS is microbiology, followed by hematology, blood banking, and urinalysis. Thank you.